My name is Lori Grace, and I'm the Executive Director of the Sunrise Center. And I'm really happy to see all of you here. And I got turned on to the whole topic of dental health, both at Brian Smith's office, the dentist that I see, and with Samira, who is an amazing educator for me. And we're going to go through some of what I learned over time, and I'm excited to share it with you. And we also want to hear from you, and you know, what's motivating you and exciting you to be here. We all want a lot of health, right? And one thing that's exciting about this is prevention. A lot of the focus on this is going to be prevention and what we can do. It's not really rescue dentistry, it's more prevention dentistry for the moment. And that excites me, as does other forms of prevention, whether it's brain fitness, cardiovascular fitness, different things. So anyway, I also wanted to let you know, in case any of you are interested in having more integrity and security about our elections coming up, that I'm doing something with people, experts from all over the country, which we have brought here to Sunrise Center to discuss what we can do to have safer elections on Saturday afternoon. And that'll also be live streamed. So if you're on our mailing list, you can either come here and have a really personal connection or watch it live stream. So, but with that, I also want to say how happy I am, Samira, that I'm here with you, and how much I've learned with you. I celebrate that. And Samira would like to hear, and so would I, from all of you, just your name and what brings you here.
Right, and I just want to share. So I'm Samira Neva Wilson.
Can you all hear?
Can you hear me?
Okay.
Can you hear me
No,
now?
they can't hear.
You can't hear
So
me.
you
Okay,
get-
is that
so
okay? All right. Is that better? Okay, great. I'm Samira Neva Wilson, and I'm a hygienist originally from New York. I have 2 kids, and I live in Sausalito. I practice in Mill Valley. I'm also a medical intuitive, and I'm actually blessed because I get to do work that is satisfying in that I get people to not see dentists because I don't really like dentists. And so I hope that you get something out of tonight. And actually, if it's okay with you, if we could just take just a couple of moments and just settle ourselves and do like a very quick meditation to just be present and be able to kind of leave our day behind. So if you just let your eyes flutter closed, right? Just notice your breath. Breathe in through your nose. Breathe out through your nose. Just notice if you can take your breath down to the soles of your feet. Again, breathe in through your nose and out through your nose. And now just greet Mother Earth underneath your feet and invite Mother Earth, Gaia, to come and rise up through your feet. And with your breath, you're going to just breathe more earth energy from Mother Earth up your legs until you feel that it collects at the base of your spine. And then everybody take a nice big deep breath in through their nose, and with the next exhale, you're going to exhale out earth energy down through your grounding. Imagine a cord going straight down from the base of your spine. And now that you're connected to the earth, in the same way that you breathe and you inhale, and you breathe in what you need, and when you exhale that which does not serve you. You're going to do the same thing with the energy that's coming up your legs, with your breath, and whatever doesn't serve you and you wish to release, you can go ahead and let that drop down. Let's take a moment and have some gratitude. I'm very grateful for all of you being here. This is a moment for you to be present and leave everything else outside the door. Great. Now just go ahead and wrap your arms around yourself, give yourself a hug, and welcome.
And thank yourself for the care that you've created for yourself right here, right now.
Great. So if we could just go around and just if you want to say your name and what your intention is for tonight, if there's something specific that you were trying to get so that we can hopefully meet that need. And did you want to pass this around or do you want to just speak up and I can repeat? Okay, shall we start in the beginning, the front?
My name is Anthony.
Anthony, hello.
And I have, some dental problems that I deal with as they along the way. But it's sort of something that I've learned quite a bit. But I thought probably going to be more to learn here, so when I come.
Great. So you have quite a few things going on, and you've had them going on throughout your life, and you wanted to learn some more things.
Well, not throughout my life, but I had some crooked teeth, two were taken out in my early teens, and then it seemed to be fine for a long time, and one thing led to another. So, yeah.
Well, thank you. I'm glad that you're here.
Hello, I'm Natalie, and I'm here for many reasons. One reason is I'm actually looking for a new dentist and a new hygienist. But the main reason I'm here, Lori showed me when she showed me the flyer a couple days ago, I saw everything just was like, oh my gosh, I have to be here because I've had a lot of dental trauma since my childhood. I've had surgeries, I've been cut open from here, just all these just traumatic surgeries, and I've always had horrible dental experiences. I brush and floss and all that stuff, and I don't know if you wanted me to share this so soon, but the connection between teeth problems and heart problems is real because I had a heart attack last year at the age of 53. So there is, trust me, there is a connection between dental and heart and cardiovascular, and it's very scary.
Wow, thank you. Thank you. Did everybody hear that? Okay, great.
Yeah.
Hi, Leah. Hey,
Hi.
welcome.
I'm Leah Walters, and I'm old enough to have gone through many years of all kinds of dental situations, and ended up in Mexico. Went down to this, the American Biological, whatever it is, and just had all the root canals taken out, everything taken out.
Wow.
And now I'm dealing with, I'm okay, but I have partials. But I know enough not to try and do implants and that sort of thing. So that's kind of where I'm at. I'm just accepting that it's turned out as good as it did.
Okay, so you have partials, you're accepting, and I'm guessing you're here to preserve what you have.
Yeah, probably to wish I'd done things differently. My regrets too.
Okay.
Actually hold this up so I can say stuff too and have it be heard.
Yeah, just hold it the whole
So
time.
thank you. I heard that you had some work done in Mexico. There's lots of people who do that because it is more affordable. And also they tend to be all trained, many are trained in the US. Sometimes they're even dentists from the US that have moved down there.
Exactly.
We were just giving our name and saying what our intention was, what our hope was for attending this class. So,
My name is Celine, and my teeth are thinning despite much better oral hygiene than I've ever had before, and I think my jaw is in the wrong position, and there was another hygienist who gave a presentation that I learned a lot from, but she cautioned us against brushing. It's not good, she was
Wow.
staining, or with brushing too soon after a meal.
Oh, interesting.
Too soon after a meal, or with too abrasive a toothpaste. In fact, she was against toothpaste. So now I have a problem with staining because I eat a lot of pigmented foods,
Got it.
drinks.
so so you said your teeth were thinning, and so that I want to know, can you say more about what thinning teeth means?
Well, I used to go to the dentist, and those pictures of where they're trying to sell you, have your teeth look perfect. My teeth looked almost like that.
Yeah.
They were like bright white. Now they're not so white, and there's, some chipping.
Yeah, because I'm thinking thinning means it's getting, like thinner.
The
But so it's
enamel,
a different,
you mean?
it's a different definition, I just wanted to understand your definition. Okay, so they're just looking darker, and you also had information,
And like a little bit translucent.
Yeah.
Or, you know, bright white and,
Translucent.
got it,
bright white and
yeah.
opaque and.
I mean, it happens in life, as we mature, our teeth get darker, you know. But thank you for sharing that.
I'm Shelley.
Hi, Shelley.
And I just want to learn about this whole subject. I've heard it kind of bubbling up in the, the larger conversation about health over the last couple of years. And then I know Lori got very interested in it, I don't know, a year or so ago. And I actually worked for Lori. I worked one for bookkeepers. And when I would go to visit her, she would have all these like facts, but we were busy taking care of business. So we didn't stop and have a whole thing. So I really wanted to fill in the blanks and find out more about it. And I've also heard of your practice around town from other people and just how amazing it is. So it just seemed like a really good opportunity to drill down and get more information.
Awesome, great.
All
Well,
right.
she is one of my favorite students.
I bet.
That's right.
Yeah, she dives in when she gets
She really
interested
does.
in something.
Full on.
My name is Michael. I'm a good friend of Samira. I'm here in support of her. And I'm suddenly aware of my teeth.
How'd that happen?
I think it was some telepathic communication, perhaps. But also, every time I go to the dentist, my dentist tries to sell me surgery.
Oh my God.
And it's the kind of surgery where they take the skin off your palate and reconstruct the gums that are receding. And it bugs the heck out of me because I don't want surgery. And while I see and acknowledge that there is some recession, I don't need to pay for surgery in order for that to happen, right? So I'm here to learn about how to maintain, if not improve, my own gum health without succumbing to the pressure to buy surgery.
Wow.
Thank you.
Okay,
Wow.
That's great.
Fascinating.
My name is Paul,
Hi,
and
Paul.
I am here because I really want to more fully understand the holistic impact of what happens within my mouth throughout my overall well-being. So,
That's great. This is a perfect place for you to get that information, to get that connection, because there is a connection. It's ironic that we'd actually have to have a conversation about your mouth being part of your body. But that's a thing.
Surprise!
It's like you don't just drop off your teeth. Well, sometimes you drop off the teeth. But it's connected to the whole person. And so, yes, thank you. Thank you for being here.
Well, my name is
Next.
Jefferson, and I'm here to help, and as well, I'm interested in the current trends in modern dental health and dentistry, and even into genetic and engineering and evolution. I heard it's kind of a big project these days, and I'm here to help.
Great, thank you.
My name's Dave, and I was at a presentation a while back, and it was actually a very good medical doctor, and it kind of came up on the side how important the mouth health was for the whole body. And I didn't know that. I never had made that connection. So when I got the email from the center that there was going to be this presentation, I was so excited. I knew I had to be here.
Oh.
And especially that, you mentioned so much about prevention. So
Yeah,
I really appreciate this.
Great, thanks for coming, Dave.
great, wonderful.
I hope you get at least 3 good tools. Maybe you can tell me later.
My name is Doris.
Hi,
I'm here
Doris.
for the same reasons that have been already mentioned. Overall health, mouth health, holistic health, and learning more about it.
Thanks, great.
Great.
My name is Katie, and I want to up-level my practices related to my dental health and have it have a great effect on the rest of my body.
I love that. That's a great thing, Katie.
My name is Phil, and I'm a dental technician, and I've had a dental laboratory in Marin County here for like 45 years, and I've been making teeth since I've been 10, so I have 68 years of making teeth. And I'm here because Lori was really excited and I talked to her, and so I want to support her.
Awesome.
And by the way, I have every one of my natural teeth.
Yeah, I was just going to ask if you make your own teeth.
No, God put those there.
Very good.
Oh, great, thanks for being here, Phil. So we might
And
ask you
Trevor.
for questions
Let's
if
get
we
Trevor.
need. Oh, hi, Trevor. Sorry.
I'm Trevor, and I'm very keen to know how this dental's health is anything to do with the rest of the body, which is a new information for me that I wasn't aware of.
Okay, great. I'm glad that it's new information that you're getting now. Yeah, great.
And I want to say a word or two, okay? When I was growing up, I thought you brushed your teeth just so you get to have fewer cavities and you brush, and then later I learned how to floss, okay? And that the mouth was the mouth. It isn't the body. And then when I started studying cancer, way later, and I saw in a film by Burton Goldberg, and I took care of a cancer patient, I learned that her teeth were terrible, and she refused to floss, and then I saw a PET scan where you could see inflammation coming right down here to her breast, where she had cancer, okay? So that began to wake me up. Then I checked my own cardiovascular system and found I had LPLA2 raised. In other words, I had a little inflammation you know, not a good cardiovascular sign. And I was at the anti-aging conference, and the doctor came up to me and said, "Do you have any inflammation in your gums?" Well, I didn't have a lot, but I had a few bleeding sites. So I began to understand that there's something that begins, that we're all connected, that our mouth is a part of our body. Surprise. Hey, Mom and Dad, my mouth is a part of my body. It's not just my mouth. All right? And so then I got studying the microbiome and understanding that the bacteria that are in our mouth help us, some of them. And some of us they don't like us, you know? And we want to have the good guys in our mouth. And then I learned that my blood pressure was affected by what bacteria that I had in my mouth that can help produce nitric oxide, that helps with lowering blood pressure, it helps with erections, it helps with a lot of things that are quite fun, with vasodilation in the capillary system and in the blood vessels. Okay, so this goes on, and this we're going to show you more of this, but it's so exciting, and it's so exciting because you can do something. You're not just like some helpless person going to see the dentist or the doctor. You can make a very active difference in your own life. And whether it's brain fitness or cardiovascular fitness or oral fitness, let's do it. You know, and let's be totally vital and fully alert and everything at 100. How about that? All right.
Now you know why she's one of my favorite patients. Totally motivated.
And excited to motivate others. So I have lots of friends around me when I'm 100. And not just younger people.
That's right.
Yeah.
So, as the slide says, our health and the health of our mouth are one. And then the next slide is what inspired you.
And one thing I loved about this dentist is an educator, Brian Smith, a dentist. And I would go, when I would go sit in the waiting room to go see him, oh my God, there are all these books on dental health and its relationship to the whole body. And so I finally borrowed one from his library, and I took it home, and I got to discover even more, and I was amazed. And one little bitty bit that I was amazed, do you know that the microbiome helps us balance our sugar balance in our body and protect against diabetes? I mean, if you have the right microbiome in there. Anyway, it just goes on and on. So this is a good book, and I just brought it. So.
Brilliant, thank you.
Okay, you're next.
So oral and general health are closely interrelated, as we've been talking
And
about.
that's the ice cream
Oh, I'm
cone.
sorry, the ice
Thank
cream
you.
cone. Okay. Your mouth, this is one of my favorite things to say. Your mouth is a mirror to the rest of your body. So your mouth mirrors what is happening in the rest of your body and can provide early signs of systemic disease. So sometimes there's something going on that's in your body and that you might not pick up on it, but it shows up in the mouth. And sometimes the mouth shows something that, you know, it works both ways. So it could be something that's from the body or it could be something that's from the mouth. But bottom line is, you're one entire being. So if you have bleeding or inflammation anywhere in your body, that's not a good thing. But you can manage your oral challenges. So the idea is, think about what's a healthy tooth. So, you know, this is a helpful slide because a lot of people, you may have some of this information, but just in case, I don't want it to be redundant, but you can see, I'm going to give you the toothbrush so that you can be doing the pointer. You'll be Vanna. There you go. So there's the enamel, which is like the helmet that's on top of the tooth. That's actually the most calcified part of the human body. It's 95% calcified. Bone and the inside part of the tooth is only 50% calcified. So think about it. Makes sense, right? You have to be able to bite into bone if you need to and not have your teeth shatter. What that covers is the inside part of the tooth, which is dentin. Dentin goes from the top and goes all the way down to the roots. There's also a very thin covering that's on the roots that's called cementum. That's just right to the left above jawbone. Go down, 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 down. There you go. That's cementum. So cementum is like that little thin protection. It also has vessels and the ability to communicate sensitivity. So sometimes if you have a little bit of recession and you're like, why am I feeling sensitive? It could be because of, you know, there's some exposed root and cementum. That tends to not last long if there's exposed root, and then you just have the dentin. What you can see, what's interesting about this is that it shows that there are little tubules, which I'll show a picture of later, but there's a connection that goes from the outside of the tooth to the inside of the tooth and back and forth. It's not just the nerve. So the center of the tooth is the nerve, and it has, you know, blood supply, it has nerves. It's like this is where the nutrition comes. There's also little baby cells that are constantly laying down more dentin, so that as you get older, you start to chew more. Your teeth get thinner, but they're not actually getting thinner because they're kind of bulking up in the same way that your bones can add. There's osteoclasts that lay new bone cells, so that's what happens inside the tooth also. You can see that the tooth is actually not bone. It has a relationship with the bone. I like to describe it as like a screw that's in sheetrock. So sheetrock would be the bone, and the screw is the tooth. And so that's helpful to have a good understanding of. And what happens is that in the same way, for those of you who've ever screwed something in, you know, they sometimes have those butterfly plastic things that go on. So there's actually a relationship between the tooth and the bone, and it has like a little bit of a coating, almost like an eggshell. So this is relevant for those people who have had teeth that have been extracted, because sometimes there might be a little bit of eggshell that's left, and that can cause some complications because when the bone heals, it wants to heal bone on bone. It doesn't want to heal around an eggshell. So just as a, you know, for those of you who may have had those considerations. Let's see, did I cover everything? Yeah, so you can see that the gums cover the bone, and there is a space between the gum and the bone, and there's a space between the tooth and the gum, and that's the place where you want to definitely try to be cleaning. So we'll talk about that a little bit. I'm going to go to the next slide. Did anybody have any questions about this? Okay, so when there is an imbalance anywhere in your body, it can lead to disease, right? Dis-ease. And that's true everywhere, not just with your teeth, but specifically with your teeth. These are some of the things that can happen. You can actually get decay in between, starting from the top. You can get decay in between the cusps. So a cusp is like a little mountaintop, right? So when your teeth form, they're supposed to actually have enamel where the valley is. So you've got the mountains and then you've got the valley. But sometimes the enamel isn't so thick in the valley. And then when you're a kid especially, if you get a little bit of bacteria in that little valley, it can lead to decay, because how are you going to scrub a little tiny valley? So many kids end up having, like many of us have had fillings that are just on the chewing surface, and that's partly the reason why. It could just be that it was a developmental thing, not just because they're eating sugar and candy stuff. Another form of decay that you can have is the kind of decay that just comes in on the side. And so that is a smooth surface cavity. That sometimes happens on the in-between, because remember that there's more than just one tooth, right? They have a relationship. So for people who aren't fans of flossing, that's the kind of decay that can happen if you have that kind of nasty bacteria that breaks down the tooth. If you can't brush it off, you want to try to do something to remove it. So that's where flossing comes into place, because when you have a tight space, the only thing that can really fit in there is floss. But there's other options. It's not always the only thing. You can use little picks, you can use, there's different, we have lots of, accoutrement here that we'll go over. When you have root exposure, you can also start to get root cavities. Now, one of the things that is very important for people to know is that many medicines that you have may cause dry mouth. And if you have that dry mouth, it actually makes the environment much nicer for the bacteria. And typically, it means that you get more plaque. Plaque is the sticky, gooey stuff that has bacteria in it. And it tends to like to live around the roots. And then you end up, you're more at risk to having root cavities. So you don't get root cavities if there's bone and gum covering the root. That kind of makes sense, right? Let's see, what else is in there? Okay, so you can see on this slide also, it shows that the gums, which is called gingiva, has like a little bit more of a redness. And so what happens is, if there is bacteria that's left, our body tends to not like it. And so what it does is it sends all of these fighting cells and floods the area, which then causes inflammation. So for like a few hours or maybe a day, the bacteria that initially caused the inflammation will be wiped out. But then they can actually have other bacteria that are opportunistic that then start to feed on the tissue that's inflamed. So you end up having this nasty cycle that happens. Is this grossing everybody out? Okay. I don't know if you knew this, Lori, but
Which part?
the part that I just said, that it starts to feed on it. So
Yeah,
you
I
end
think
up
that's
having
very
more
interesting.
inflammation, and the cycle continues. So it's actually your body's trying to fight it. And so then, because there's an irritant, it starts to cause breakdown, and the bone and the gum start to move away. They don't want to be close to that. And so then you end up, again, it becomes like this vicious cycle. What else? Okay, so then you can see the center of the tooth has a pulp. So for those of you who may have had a root canal, what a root canal is where they go in and they clean out the pipes from the main trunk of the tooth, which is just the pulp. The challenge in that is that you still have little tubules, which I will show you on the next slide. So this is what the root looks like under, I don't know how much magnification, but you can see there's little tiny tubules. And what happens is, when you have a root canal, it only handles the base trunk of the tooth, like the tree trunk, right? It doesn't handle the little extensions, the thousands of other extensions. And so why you have to be somewhat aware and, ask around root canals is that everyone has a different ability and level of being able to tolerate things in their body. And so if you have a tooth that's not able to tell you that something's going on because the trunk has been cleaned out,
Dead.
it doesn't mean that it's still not getting information, either from the body into that space or from that space leaching out into the body, because there's still those tubules.
And what bothers me about this, is those, see those little white things there? That's actually bacteria.
That's
Now,
a bacteria.
It might be nice bacteria or not so nice.
You never will have no bacteria. I mean, we know that, right? So, but that was an interesting thing.
Another thing is, how many of you have eaten something sweet and something like hurt kind of a little bit in your mouth? Have you ever had that? Well, what I learned from a dentist, and apparently you're confirming it, is the bacteria get very excited and they start urinating. And it excites them. It's, reproduction time, it's feast time, and so that was amazing to me.
That's
and
disgusting.
Very motivating.
Yeah, I actually know a dentist who likes to floss, and then he gives it to the patients to smell, and then it's kind of like a poopy thing. So you can recognize that there's a cycle that happens because, you know, it's the circle of life, right? And I'm sorry, you had a question?
About the orientation of the tubules. Like
The orientation of the tubules.
What direction are they relative to the?
Okay, so all the tubules have a connection to the center, to like, you know, so if you think of the pulp as the heart of the tooth, let's just say, all tubules lead to the heart.
Okay, so they might be angled at different directions.
Yeah, so
They
they'll
all
be
look
angled
parallel.
up and down,
Okay.
and right. I mean, you just see this under magnification because you're just looking at it straight on. But here's another.
So is that's
Here's another angle, okay? Where
I don't know if this is more helpful or less so, but the idea is that it shows you. Well, this was your slide.
Well,
So-
it says microtubules and microfilaments, okay? So these are filaments, these are here, and this is a tubule. Do you see it looks like a tube?
So what
And-
happens to those when you have a root canal?
Okay, so what happens to them is that if it was an infection and you didn't have sufficient handling of the infection, you may still have some of that infection in the tubules.
And how will that affect your teeth?
Well, that's where it goes back to, for some people, they can tolerate having a certain amount, you know, but unfortunately, given the amount of toxins that we're constantly being bombarded with now, many people are just not being able to manage having more of a challenge. Like, having a root canal for some may be fine, but for others, not at all.
So if anyone who has had a root canal, there's still like bacteria in there.
Potentially there is bacteria, exactly, because you can't get it through all of those tubules. I mean, there are people who have root canals and they're really great endodontists, and there's ways that you can handle it. They use ozone, which is one of the things that I use in my practice, because it kills the bacteria, virus, fungus, and parasites on contact, and it's a gas that you can apply. So it's makes it as pristine as possible, but it's still never going to be the same as having a tooth that doesn't, that's still alive and has, there is no perfect solution.
So does your practice do anything as an alternative to a root canal? Because I was told I need 2 root canals, and I was told this 2 years ago, and I still haven't had it done.
Well, I mean, our practice, we have patients. I mean, I can't, give you dental advice without having seen you, but there are different things that you can do that maybe, there's sometimes you can push it off, you can get ozone treatments, and you can, I mean, that's, I'm just saying as a possibility. So just think of me as the internet right now, so you've got to check it out for yourself.
Right.
But we do have patients who do different things, and it's always good, it's like measure 3 times and cut once, right? So get another opinion, find out. Like, there's different people have different perspectives, and based on what they're seeing, that's what they're gonna identify.
Yeah, and I have a comment on this too. I never had any problem with a root canal or any symptoms or anything. And then, I'm listening to all these holistic doctors, and they're talking about you can have germs in your root canals. Like Klinghardt is talking about Lyme spirochetes in your teeth, and I wasn't having any symptoms, so I just thought, well, I don't know, this is like a little extreme. But I was very happy, and there's a better slide we have, but it's not there. Do you see these little spaces here? I mean, it's not very well done, but it's these are little places where bugs can lodge. So let's say you have gutta percha, you know, you have root canal, and here's the gutta percha going all the way down the root. You still have lots of opportunities. The tooth doesn't have an immune system, all right? So it can't fight. It doesn't have a nerve, so it can't warn you, all right? So there could be something in there. Now you might end up getting a reaction in your gum from it, and then you have to have your root canal dealt with. And so I decided, having understood how related our mouths are with our whole health, I decided, hey, I told Brian Smith, I said, I want to find out if I have a hidden infection that I have absolutely no symptoms for. So I did a 3D x-ray, and lo and behold, there was a little infection in a place where a tooth was pulled. There was a tiny little bit of tooth left there. There was a place where I had a fair amount of infection where I had a bridge underneath that, and I feel nothing. And I don't have any health problems, you know, but there it is, hidden, okay?
It's like a leak that's just leaking.
And someday it might get worse, and I'm very glad I have.
Or not.
I said, why am I not getting any symptoms from all this? He said, well, you have a strong immune system. All right, thank you. But some other people might not, or maybe mine will get bad later, you know, so, you know, that's why I love exploring and understanding. And if we don't explore, we're not going to prevent.
Well, and also the 3D x-ray, we have a picture of it later on that
Yeah.
you'll see what it looks like. But what a 3D x-ray does, as opposed to the ones that you usually get, like the checkup x-rays, everybody's had those little credit cards in their mouths, right? Or even like you might have a panoramic where they, you know, just move this machine. But what it does is your head is obviously three-dimensional, right? And when you take an image, you're flattening it into two dimensions, right? But a 3D x-ray actually takes it like, almost like an MRI, I imagine. It's like it slices your head in images, multiple images. So now, you know, if she hadn't had that x-ray, perhaps she wouldn't have been able to detect a little tiny piece of a fragmented bone because it collapses. So the image doesn't necessarily show, it just looks like a calcification. And so that's where having that extra information is helpful.
Yeah, and so I have a situation where maybe I should do an implant, but right now I'm putting it off with injections of ozone through my gum, where I feel nothing, I have no problems, you know, and I'm hopefully holding it off with ozone for a while. But, you know, I've been told to contemplate this thing. So anyway, I'm just mentioning my own stuff as an example of prevention. Okay.
Great. So
on.
let's move on. We did this. Okay, well this is kind of fun. So we talked about we didn't really talk about the types of restorations that you can have. But one of the things that happens, because it's still allowable, is there are still amalgam fillings happening, being placed in the mouth. Amalgams are different kinds of metals that have mercury in them that kind of lump together, and the way that it attaches, the way that they would put it into the tooth is it would be mechanically attached. So they'd make it pretty big and bulky so that it could have enough that it won't just fall out, because it's not like it can become like part of the tooth. And the challenge is, and this is the image that shows, is because it's a metal, metals don't necessarily have the same temperature fluctuation as teeth do. And so if the person has continued rapid change in temperature, cold, hot, the metal is changing at a different pace and can actually fracture off. And then this is what it's actually showing.
And this is what I learned from you, Phil. And so I decided to put it in the slideshow.
Good.
Thank you. And another thing I learned from Phil, which was kind of shocking, was that if you're a dentist and you talk about amalgams not being so good officially, you could lose your license. Well, that's because the ADA had a liability issue. Think of the millions of people that have mercury in their mouth, okay? And what happened for me is years ago, I decided, they said, oh, do you want to find out how much mercury you're taking into you each time you chew? And so they had me chew this little piece of gum, and then they stuck a mercury sensor in there. And oh my God, every time I was chewing on a piece of food, more mercury was coming in my system. So finally I had all my mercury fillings removed with Phil, and it was done well with a dental dam and also protection so I don't inhale anything and the dentist doesn't inhale anything. And then I learned from you, Samira, about the huge restrictions about disposal of mercury. And my God, the ADA and people have been putting it into their mouths for years. And it's neurodegenerative. Do you know what that means? You can get, mercury poisoning.
That's why there's so many crazy dentists out there.
That's why there's so many crazy dentists out there. That's
You know
right.
the Mad Hatter from Alice in Wonderland, remember?
He was a dentist, right?
No, he's a Mad Hatter, but they put mercury on the top of the top hats. And he would say, I'm very merry on birthday to you, it's in Alice in Wonderland.
Yeah.
So anyway, I've decided to invest in this company that can completely remove mercury from the system. And it was, unfortunately, it was being used with some people who developed seizures after vaccinations, children. And some autism, and the FDA broke into his lab, but now it's completely legal and being fully used in Colombia, Ecuador, because Ecuador had a very big gold mining thing, and there was a lot of mercury that's used when mining gold, and also in Lebanon and New Zealand and England, all right? So this is going to happen. In about 2 years, you'll be able to get it even over the counter.
Well, what's helpful to know is that
Yeah.
before you do a mercury detox, you want to make sure that you don't have extra mercury. So for people who want to not have, it's like, oh, I want to make sure I flush my system out of mercury. Well, if you have mercury fillings in your mouth, you're going to be just drawing it out of those fillings. So, you just want to, again, be aware and make decisions based on what works best for you.
Yeah, and thank you for teaching me, Phil,
You're welcome.
about mercury. I so appreciate you.
I would not work for a dentist that had mercury in their office.
Uh-huh.
Yeah.
I agree with you.
And one of the
Actually-
highest suicide rates, by the way, in dentists.
Yeah. What's interesting is that one of the doctors that used to work with us, he opened up his practice in Utah. And when he went in, they have these inspectors that come in and want to make sure, how are you managing your waste? We have a specific inspector for the mercury. And he said, well, what do you mean? Well, any little piece of the metal that you didn't use in a person, you have to dispose of in a certain way because it's a neurotoxin, environmental issues, right? And he said, well, how come you're so strict on this, and yet we can put it in people's heads, and it stays for decades. And unfortunately, you still have to place amalgam fillings to pass your dental boards.
Oh, come on, really?
Really. So
Oh my
NYU actually
I
recently
discussed
had decided that they were no longer going to be teaching. I mean, because imagine you're in a room with 25, 30 other chairs. They're all putting mercury. They're all using it, and they're putting
That's
it
shocking.
into people. And so
Oh my
NYU
God.
said, no, we're not going to do it. Well, the ADA and the board decided that they would remove the accreditation for NYU. The hope was that NYU would be the first one to set it down into motion, but no. So now they have to go back to what they don't believe in. But so just so you know,
That's
heads up.
shocking. Oh my God.
Yeah, because
Wow.
just the irony is that people they don't recognize, they haven't connected the dots. Mercury is bad. And then you've been having these mercury fillings. Okay, so it's like, well, why does it not connect? And that's basically what's happened.
We probably make
So-
money.
Money,
I
follow
want to
the
let you
money.
know that
Yeah, easy peasy, we know how to do
my
this.
friend who works for me, Rich Davidson, went to an ordinary dentist who wasn't skilled in removing mercury, and his mercury levels shot up after he had his fillings removed, and now we're gonna have to deal with trying to get it out of his system. And so you've gotta be very careful, if any of you have mercury fillings right now, that you choose the right dentist.
Right.
Who really knows what they're doing.
What's ironic is it's easier to do the plastic filling than the mercury filling.
Yeah.
That's shocking.
It's just ridiculous.
It was all a liability issue.
Yeah.
How does one know there's mercury in a filling?
If it's silver.
If it's a silver metal filling, well, this is one of the other challenges, is that many times people have crowns. No offense, Phil,
And
but
it's
people have
inside.
crowns, and if they have a root canal, sometimes they'll put amalgam in
Yes,
their
I had one.
packet,
I had
and then
one
they
like
put the
that.
crown on top, and then you can't tell.
Well, you also have dissimilar metals which cause an
And-
electrolytic
right,
action,
so-
which compounds the problem.
The dissimilar metals, so if you have a gold crown and then you have one of those porcelain baked to metal crowns and they're next to each other, that's not a happy situation.
My
And
God.
the thing about mercury, I mean, this is, I think you kind of appreciate that, and is that mercury is not just toxic in itself. Mercury actually bonds with other heavy metals to make them even stronger. So it's not just, you know, I mean, I kind of joke and say it's the
Nickel especially.
polyamorous heavy metal because it bonds with anything and everything and then makes it even worse. So there you go. I know it's kind of depressing, but the point is that there are things to do and to be aware. You know, it's not,
And if you've had mercury fillings removed and you still have mercury, you can contact me here at the Sunrise Center and I can direct you towards this, which will become legal in about a year.
What's it called?
But you can get it ahead of time because I have a special relationship, all right?
What's it
What
called?
is it called, Lori?
It's called Emera-Med.
E-M-E-R-A.
E-M-E-R-A and then med, M-E-D. And, you know, I can't do it for everybody, but I'm just letting you guys know. And I'm investing in the company and they're about to get a big investment, but I wanted it, you know, for my friends. And also, I'm using it, it gets rid of other toxic metals. And I'm high in lead and calcium and cadmium myself. And I do not want to do the IVs to get rid of it. And another thing that's really interesting about this stuff, because it was developed by a chemist called Boyd Haley, who I talk to frequently now, it crosses the blood-brain barrier. So if we have neurodegenerative disease in our brains, if the mercury crosses the blood-brain barrier, where it can cause dementia, it's very related to dementia and Alzheimer's, we can get it out. You know, I mean, my God, and my top interest is brain fitness. And so, of course, I had to get this, you know, and go for it. So, anyway, just letting you know.
Yeah, actually, one of the things, the best way that mercury was described to me as why is it so bad, I mean, everybody says it's really bad, obviously, but what it actually does is it impacts on the nerve sheath. So it's like, you know, you have the electricity and then you've got the plastic on top of it so things don't communicate. Well, it's supposed to be continuous, but mercury actually causes little breaks in that, so then other things can then get in. That's what I mean about it being like the friend of all the nasty stuff. Okay, on a happier note, wait till you see the next slides. So we all know, again, back to your mouth being part of your body, Chinese medicine classic, they don't actually touch your body. They usually just check your tongue, and your tongue can tell you a lot of things about your body. There's different sections that are related to the tongue, and so now I'm going to just show that.
So if you have a new lover, you might ask them to stick out their tongue. please.
Stick out their tongue. Not in the dark.
Yeah, not in the dark.
Not in the dark. Okay. So here's, aside from the Chinese medicine, there are other things that you can be aware of. Now, some of these slides, just be prepared, doesn't mean that it has to look like this. The idea behind this was to actually just let you be aware and look. If something doesn't look right, if you have any question, get some professional support. Find out if there's something that's going on. This is a patient who had
An oral yeast infection.
An oral yeast infection. So what happens? Your mouth has an entire population. It's got its own little environment. It's got bacteria, there's fungus, there's different things going on. So if you take antibiotics, as we know, it can affect your gut, right? So you take probiotics. Well, you can also take oral dental probiotics because your mouth is part of your digestive system. And this is a person who had, obviously, for some reason, a yeast infection.
And I have had oral pleasuring from a man and then gotten a yeast infection the next day. All right? So, you know, I want to be careful of who's pleasuring me.
Just as a note, if you notice here, where if you point to the part of the tongue that's like all the way towards the back, that's like got the most yeast, right? So interesting enough, if you come back, you can see that that's an area for the intestines. You see? So it's not like it's this magical stuff, but if you have the map, you can then check to see what else is going on.
And Donna, why don't you talk about this little thing down here?
Yeah, what's going on?
You know, this little dip here.
A mother's
And the
snake.
MTHFR.
Oh yes. Oh, so
Mother's
there's,
snake.
see how it's like a little
That's it.
snake tongue? Okay, so for people who are tongue-tied means where you know, if you stick your tongue up to the roof of your mouth, it's actually being held down by something called frenum. And when you are a child, when you're growing and your connective tissues are developing, you need to have MTHFR, which is an enzyme that helps to break down folic acid. So
And a
many,
great many white people are missing the synapse that produces that.
right,
And
many
they
people
also,
don't have that.
And they also have substantial cardiovascular problems, and it can be related to childhood autism also. It's spina bifida, you know, all of those things, because it's the incomplete metabolism of and creation of folic acid.
So
Folic acid to folate, excuse me, which is a critical B vitamin in our systems, okay? And what you can do is you can work against this problem by taking methylated B vitamins. And you can easily buy that at, you know, you can buy methylated B12, methylated B6, methylated, and, you know, folate at Whole Foods.
But you can
And
also
it's
be
cheap.
tested. So I mean, for those of us
Well-
who have children and you took prenatal vitamins, you were wanting to protect your kids, but if you don't have the enzyme, they probably don't either. So it's like you're taking it and it's just going away.
Right, but you can take the B vitamins
But you
and
can
it
take
cleans
it,
up.
right.
So prevention, here we go.
Why would it be white people that are affected?
It's just very
Just
high
lucky.
in white people. You know, as we moved into Europe and everything like that, yes, we developed lighter skin so that we could produce more vitamin D per sun exposure. We have higher skin cancer rates, and we just happen to have this, you know, this particular genetic thing. And I don't happen to have it, but other people who do have it are struggling at times with their cardiovascular system.
Okay.
But it's something to learn about. There's this whole development of something called genomic medicine. And like I had my whole genome done, you can do it too with 23andMe. It's very limited though, comparatively. If you want to get a really involved study of your genome, go to Genova Diagnostics.
Does anybody want to stand up and stretch for a moment? Are you good? Okay, yes, please get up and stretch. See, you guys all look just as excited as most of the patients in the dental office.
We're stretching.
Oh, is that what we're doing? Okay. This was our
I'm gonna have them look at this
7th
slide.
anniversary.
Yeah, I'll direct them.
Okay, great.
Okay.
Great. Here we go.
Okay, all right.
Carry on.
So I'm the one who's bringing in this, and I began to understand that oral HPV is positively correlated with, I learned it in reading Scientific American once, that there's a spike of throat and neck and mouth cancers in men. And that, you know, it's actually an STD. I mean, you may not have been taught when you find out whether your prospective new lover has an STD. How many times did you ask that woman, what is your latest Pap test? And what is your level of cervical dysplasia? Could you let me know? All right? So when a man, or it could be anybody, you know, when you suck on anybody, you can get HPV from that. And I know several men who were very active in the sexual community here in Marin who had to struggle with healing from that, okay? So, but if you want to understand, you first of all, you can get tested for oral HPV just by ordering it on the web, selfcollect.com. And we have something for that if you test positive. This is something that you told me has been helpful,
Okay.
and you're going to talk about this, okay? Right? For dealing with oral HPV.
Well, I don't exactly remember that conversation,
You did
but
say
what's
that to
helpful
me.
about this is that it
Mhm.
kills the bacteria, virus, and fungus.
Mm-hmm.
So if it's a virus and you have something that's active, it can actually help to cut it back down. I
Right.
wouldn't necessarily go this route before going to check with your doctor as well. So,
Yes, definitely.
So that's the,
And you might also want to, you know, I mean, this is an example of a starting lesion with HPV, okay? So almost everything that looks bad in the mouth is some white thing. You know, you'll see if you
here's
go
the
through
next
it.
one.
Now, this is actually developed oral cancer and throat cancer from HPV, okay?
What are we
So
looking at?
this is the throat.
So that's a
down.
throat image that I
Alright,
think
and
with
this
a
is the
camera when they
lesions.
do that inter.
And this
Okay.
is the lip, and these are the lesions, okay?
Laparoscopic camera.
And you want to know what what you've got going on, and you want to support your immune system. You want to see a dentist, definitely, if you're starting to get oral cancer. And I helped save someone's life by having him go to see a dentist to look at this sore that was painless, actually.
Yeah.
That he kept on having in his mouth, and you know, it saved his life.
Well,
He had
just
a
like anything,
biopsy.
if you have something that's anywhere on your body, including your mouth, and it doesn't go, like if you scratched and, you know, there's a certain amount of time that it takes, it'll heal. If it doesn't heal or if it starts to look funky, seek medical, dental, professional help and support. Don't just ignore it. So
And
it
the
doesn't
name-
have to be painful.
Right, it doesn't have to be painful, that's the important thing to know. And the name of the website where you can get your own oral cancer thing, because I haven't found many dentists that offer this test, okay, is selfcollect.com. And you can check out to see if you happen to have that HPV, and if you do, then you just get on it. And we can heal from HPV. Our immune systems can be strong enough to get it. We just don't want it to develop into this, all right? Through like not really knowing, okay? So again, this is prevention, yeah?
So there, I didn't realize about the HPV, but there are a lot of other kinds of mouth cancer, right? So are you saying
Well,
that?
there's squamous cell. These are HPV caused, but this is actually squamous cell, developing into squamous cell cancer. And I worked with somebody, now dead, unfortunately, who neglected his squamous cell cancer.
So
in his
many of
teeth.
us know people who neglected and are now dead. It's,
Yeah.
it's unfortunate.
And that's why I'm so motivated to teach.
Absolutely. So, but what I was asking, I guess, is it sounded to me like you were saying that self-collect deals with HPV cancer specifically, is that right?
It's a test. You can also test your penile HPV, anal HPV, vaginal HPV, and this is just a test you can get on the web, and they give you your results.
So I think the question is, does it test for other oral cancers? I think that's the question, is that correct?
Actually, yes, thank you.
No, this tests for the virus HPV.
If you go to a dentist and you have a lesion, they're required to take
Right.
a biopsy and send it to a lab.
Right, exactly. But I just think that I like this level of prevention
Well, I think it's-
and being aware. And I had something else we'll show later in the slideshow called leukoplakia, which I was getting from using a fluoride toothpaste recommended to me by a dentist, and it went away. But leukoplakia, which you'll see in a little while, I had to have a biopsy and everything, all right? So, you know, any white spots, check them out.
Yeah, if it doesn't look right, if you have any suspicion, just check it out. It's better to have more information than less. Okay, so here is a cool chart that I have that just, you might not be able to read it very well, but the idea is to recognize that each tooth runs along a meridian in your body, and there is a relationship with your endocrine system, there's a relationship with emotions. Part of it is, you know, following the Chinese medicine philosophy. The reason why we find this to be interesting is that, again, we see people, we don't just think about them as their teeth, we think about them with their body. We had a patient who came in who had a root canal on, I think it was on tooth number 12 or 13, and the person had some kind of car accident and needed to have a root canal. And then, you know, this was decades later, came into our office and we said, okay, well, by the way, do you have anything going on with your hip? And he said, yes, I've had something with my hip. Well, how did you know? Because he didn't have it on his medical history. He said, I've been having this problem. I go to everybody trying to figure out what's going on with my hip. They can't find anything wrong with my hip, and it's constantly bothering me. Well, how long has it been bothering you? It was about a year after he had the root canal. And it's like just recognizing that your meridians, which is like your energetic circuits, I like to say, think of them like Christmas lights. So your Christmas lights can all work even if one isn't on, you know, but then at a certain point, you know, maybe another one won't go on, and you know, it's a challenge for the circuit to continue flowing. And so that was just, you know, an interesting story that I wanted to share. We had also just last week, there was a 13-year-old girl who came in. She only had one tooth that was decay, just one tooth. And so why is that odd? Is that typically if the environment is kind of off in the mouth, you're not going to just have one tooth that has decay. Usually the other tooth on the other side will have something like that, but she didn't. And so then we just happened to say, well, you know, to her mom, you know, have you had her thyroid checked? And she said, oh, well, I have thyroid issues. I was like, okay, well, perhaps this same tooth, which is on the thyroid meridian, is something for you to look at. It doesn't necessarily mean that there is a connection, but it's just, it makes sense to kind of have that awareness. So this is what we do. This is what we recognize in our office. So this was actually something that, going back to prevention, is you know, there's a statistic in there that somebody just read out earlier, was that 75% of American adults suffer from various forms of gum disease. So dis-ease. Anything that doesn't look pink and happy is dis-ease. So it could be something that's just an early stage of irritation. Gingivitis. Gingiva means gums, itis, inflammation. So if you have any kind of inflammation, you fall into that 75%. What they're doing with this slide is actually showing the measuring tool that we use, which is called a probe. Most people don't like the feeling of having a ruler stuck in between the space of their tooth and their gum, but it's important to have a quantifiable measurement so that no one has, you know, it's not just your hygienist or your dentist saying, well, your teeth look okay, your gums look okay. There's actually a way to check. And so it's not personal. It's just a number. And what that shows is how far in you can go demonstrates what the challenge the person may have. So I like to think of it, the deeper you go in, the more challenging it is, because ultimately you can only really clean the topmost part. So if you've got a pocket, which means that there's a space where the instrument can go in, you're really only just still kind of skimming the same top portion. There are things you can use besides the brushing. So I mean, brushing and flossing usually only goes about 3 millimeters or so, sometimes 4.
I'd like to know, how many of you have a dentist where they check, or a hygienist or whatever, where you check for pockets? Yay! Most
Awesome.
everybody, not everybody, but.
Awesome. So, you know, the other visual that I like to kind of have you think about is that when you have pockets, here's a person who has periodontal disease. When you have pockets, you know, it can show up as it can mean that there's bone loss. Remember we talked about the sheetrock?
Yeah,
So it could
red
mean
those are.
there's bone loss. But it could also mean that the gums are so upset that they're totally puffy. So it may be a true pocket or it may not be. That's something, you know, for your dental professional and you to determine. But for example, this person here, I'm sure that if I stuck a probe into where the gums are, that puffiness is going to add to the number. So that doesn't necessarily mean this person's like, oh my God, there's no hope. This is actually a mouth I'd love to clean because it'll look so much happier after. What's interesting that Lori wanted me to point out is if you notice on top of the front top teeth, you see that white stuff? That's plaque. Because plaque can happen anywhere. It's just that sticky biofilm that has bacteria in it. And I like to say, do you guys know about aquariums and fish tanks?
Yeah.
So there's some fish that like to swim on the top surface. Super easy, you can get those fast. Then there's the middle fish, and those are like a little bit more challenging. And then there's the bottom dwellers. So the bottom dwellers, that's the bacteria that you really have to work on to get off. So when you chew food, maybe the top layer and the middle layer can be affected, but it probably won't help with the bottom dwellers. That's why you have to do more than just eat. You gotta brush, floss, use toothpicks. There's different various tools. I've got quite a few, but we wanted to just kind of share this part. Yes?
Yes, and also that if you turn to your packet, you know, you'll see that periodontal disease affects the nature of your lungs. It affects your pancreas, your diabetic health. It can affect your heart. It can affect your, breasts, everything. And
So-
we have several pamphlet, things for you to look at. And 1 in 8 women will develop breast cancer. Studies show that women who have gum disease or missing teeth are 11 times more likely to be diagnosed with breast cancer. And something that I found really kind of gross but alarming is when you autopsy a brain of a man or woman with dementia, you can find HPV viruses in there. You can find periodontal viruses from their mouth, bacteria, HPV and periodontal bacteria. And then you can also find herpes viruses from cold sores in people who have dementia and died of dementia, and you're autopsying the brains. So taking care about our viruses is very, very important. And there are certain things we can do also to combat cold sore virus.
Well, I always like to say to my patients, I can't help you with your kidneys, but I can help you with your gums and your teeth, which will help your kidneys. So, I mean, you have easy access. You open your lips, you have access to your mouth. It takes more to get to the kidney than that. So,
And pancreatic cancer.
pancreatic cancer
Is also positively correlated with
heart
periodontal
disease, high blood pressure. I mean, it's all really in there. It's again, the body is one thing. Your mouth, your heart, your everything is all connected. So, I mean, it would make sense that it would show up in your mouth. So, there.
Okay.
Next.
So,
Go ahead.
yeah, no, you
Well, some things can actually look like they're. This is an image of a patient who came in who had erosion of the teeth because they had the acid reflux, And so you can see that there's wear, and Lori wanted to share it.
And I wanted to share this because many people do have acid reflux, and by the way, do not take Prilosec to try to deal with acid reflux, because you can get huge malnutrition from it, all right? That's another topic, but the other thing is bulimia. If somebody has bulimia, and I did from 25 to 33, and the acid from your stomach can eat into the enamel right away, and this is an example of erosion.
It can also look like abfractions that are caused by bite misalignment.
That as well.
So, it can.
But if you know anybody who throws up for whatever reason, indigestion, or tell them to thoroughly clean their teeth afterwards, okay?
Great, so here's just some more examples. I think we're just kind of being mindful of the time so that we can spend time on the prevention stuff. So cracked lips and dry mouth can be a sign of diabetes, which makes sense. If you have diabetes, you tend to be thirsty most of the time. You're not able to, the water, the wanting to go to the restroom a lot. So it shows up on your lips being dry.
And this
Here's
is
the
the
leukoplakia.
leukoplakia that I was talking about, that I got from using fluoride toothpaste, and Brian Smith recommended that I not use it, and I stopped using it, and in about 8 months all of this went away. But I tell you, the biopsy was the most painful thing I've ever had. 3 weeks of pain. So
it's actually so your body.
Don't use the fluoride toothpaste.
So Lori didn't feel comfortable. Her body was rejecting the fluoride. Fluoride is also a neurotoxin. There are other ways that you can have your teeth be harder, and fluoride is not something that is naturally occurring in your body. I am not a fan. But if there's any irritant, your body will find a way to protect. And so this is almost like having a callus, like she was having a callus all over her mouth, and if that continued after a certain point, then the cells continue to divide and can mutate into something more serious.
Is leukoplakia always white, or can it be pink like the rest of the gum?
It tends to look white.
leuco is Latin for white.
Oh, okay.
Yeah, it's like white, like web-like.
Oh, okay. Oh,
Yeah.
web-like.
Yeah, I mean, you can see
That's the plaque.
on the outside, if you pull the tissue a little bit, you'd see that it would be like a little bit more. It depends on the person. I mean, I've seen it in different ways. B12 deficiency symptom. So if you have some sore, again, going back to if it doesn't look the same, check with your healthcare provider. It could be a B12. It could be something just as easy as B12. So don't all panic and think, oh my God, I have this thing. It's a terrible, terrible thing. It might just be that you need to have some more vitamins. Wouldn't that be nice? Simple.
Yeah, and B12, our need for B12 goes dramatically up as we get older. So don't, when you look at the bottle and it says 500%, it doesn't matter even if you have 1,000%. I mean, we use it as we get older, big time.
How many milligrams do we need of it? Let's say someone in their 50s.
I actually don't have
I
that
don't
information. I would
remember.
check, yeah.
But you want to get methylated B12.
Methylated.
Not cyanocobalamin. You don't want that one. You want to get methylated B12 or methylated cobalamin.
What about like the spray vitamins that absorb better?
Yeah, some of those are okay.
And what about B12 shots?
The B12 shots are fine. Yeah, a lot of people feel energy from them.
You can, at Costco, they have sublingual B12, and it raised mine up so much they told me I had to cut back.
Yeah.
So it really works.
Well, that's the idea, is that
How did you feel when you raised it up?
Fine. I didn't notice any
You
difference.
didn't notice anything, yeah.
So before you take more than you need to or less than you need to, because you can take too much of vitamins, again, make sure that you check with your healthcare provider. So we're not recommending that you do it. We're just saying this is what has worked.
And we're shortly gonna go into all the prevention tools that we have.
Yeah.
So that's very exciting. We're at the last one of
So
our
this is
diagnostic
the
thing.
this is the 3D X-ray, and you see, they adjust and they put it in what's another thing that's interesting. We didn't have a picture of this, but one of the things that happens, because we talked a little bit about fluoride. The reason why I don't like fluoride, I mentioned a few of them, but fluoride can make your teeth harder, but it makes your teeth more brittle as well.
Fluorosis.
So we have patients that have had too much fluoride in their system, and what happens is the enamel starts to chip off. So you don't want to have cement teeth, you want them to have some give. And so what I recommend rather than fluoride is calcium phosphate, which is what your teeth are actually made of, and your bone. So you're not introducing something foreign, it's just more of the same stuff, which we have some of that sample here in the front. But what's interesting is that when I had a 3D X-ray, it actually showed my brain, and it showed that I had a little tiny calcification in my brain. There should not be a calcification in anyone's brain. That was my pineal gland. Fluoride has been shown on people on autopsy
Wow.
to have calcified people's
Oh my God,
pineal
that
gland. And
sounds
your pineal
horrible.
gland is your third eye. So those of you who are into conspiracy theories and why we use fluoride and other Western countries do not, you can kind of explore that.
And
And your pineal gland
By the way-
controls your sleep-wake cycle
on,
and
on your.
coordinates all the hormones and that's the time clock of your body.
Mhm. So, just so you know, on your home care health solutions, it says use soft bristle toothbrush with fluoride toothpaste.
Oh, see that?
Oh, thank you.
That wasn't from
We
me.
didn't notice.
So cross that out.
I
Yeah,
assumed you
cross
didn't.
that out.
There you go.
definitely.
See, that's why. You've
Thank
got to
you.
make sure you
Thank
read
you.
and are informed. Don't just take our word for it.
We looked at the pretty pictures and saw
It looked
some of the
pretty.
correlations.
Right.
Yeah.
Just a word about fluoride.
Yes.
Presumably you read Fluoride Deception. If you want to find out the history of why fluoride is used by dentists, read that book. It is a really heavy book. I had to put it down halfway through because it is the history of fluoride starting to be used with Manhattan Project.
Mm-hmm.
And
Oh my
then
God.
finding a way to use the waste.
Yes.
Wow.
And
Yes.
a lot of deception and
It's
corruption
scary.
in the dental, in the ADA and the dental,
Yeah, and
Research.
Marin water people
There-
put it in.
There
I
is
know,
actually a
and they're
film. I
not
mean,
doing it, yeah.
I'm not familiar with that book specifically, but I know of the history, and there is actually a film that I have that you guys can,
We'll show
that
you
I'm
the
showing
slide
that you
later.
can watch because I don't have time. I have little kids. I don't have time to read. But I like watching things, and so you can check that
Quick
out.
question.
Yes.
Is fluoride a complete scam, or is there really some research evidence that it is good for your teeth?
Okay, so what it does, so remember those tubules that we talked about?
Yeah.
So the fluoride is actually a bigger molecule than the tubules. So what it does is it plugs in those holes, okay? But calcium phosphate also plugs in those holes. So, you can wear, a protection that's, like a nice cotton, right? And that'll protect you from the elements. Or you can use, some radioactive material that will protect you from the elements. Which would you choose?
Good answer. Thank you.
So that's just where I'm at.
It says saccharin in it.
There's actually different kinds. You can use a powder as well. It doesn't there's lots of products, so I'm not trying to promote any specific product. Check your intuition, check to see what works for you, and what works for you today might not necessarily be working for you long into the future. Just, check with yourself. So these are a few of my favorite things, even though they're electric. I am a fan of the Sonicare. The reason I
I'm a
am.
fan of the Oral B.
I know, but she's using the Sonicare too.
Oh, really? Same company?
So Sonicare is the benchmark for electric toothbrushes. The reason why I like it is because you don't have to be right on top of the spot, you just have to be close enough. Electric toothbrushes, typically you can be somewhat close, but Sonicare you can be further away from the spot and it'll still clean it for you. And so that's why I'm a fan. And The other thing that I like is the water pick. So for some of us who have spaces in between our teeth and, or maybe it's not so easy to floss, the water pick comes into play because it's like power washing the in-between spaces. So I like to think of the mouth like it's a garden. So you've got your lawn, you mow the lawn with your electric toothbrush, right? Then you have the hedges. The hedges are actually taken care of with floss because that's the in-between spot. So you can't mow the lawn enough, you can't lift the lawnmower up to the hedge because that's just insane. So you have to use something for the sides, right? Well, what if you have uneven pavement in your garden? How are you going to clean that? Well, that's where the power washing comes in, and that's the water pick. So 2 different kinds of styles of water pick. There's lots of different companies. I'm just using it as the name, where it has a reservoir, and you can put it on your counter, and you can squirt it in between. The idea is to go in between each of the teeth where the gums are at perpendicular to the space, so that you're like washing the windows. If you were going to put a hose against the window, you would point it straight at it, not down and not up. I like the kind not that's on the counter. I like the kind that's in your hand because then you can use it anywhere. And I don't really like having stuff on my counter. I also don't like the water splashing everywhere. So if you have the handheld one, it has a reservoir in it. You can fill it. You'll need to fill it a few times, but you can use it in the shower. And so how brilliant is that? You can charge it, and then usually the charge lasts like 2 weeks or something. And then you can just use it and zap it, and you just add an extra minute to your shower. Who doesn't want that? So I'm a fan of also finding ways to make your life easier so you're not spending extra hours in the bathroom. So that was a suggestion I had for you earlier, that if you have the little picks and you're using the picks, leave them in your car. We're always in traffic. You can do something at the same time. So you're actually probably giving even more love and care to your mouth in that way.
So
Yeah.
how does the water pick relate to flossing then?
Okay, so the flossing is for those in-between places where the teeth are in contact.
Okay.
If you have space, sometimes you can slide the floss in and then it's just floating around. Also, one of the challenges is, if you remember the image of the tooth, the root is kind of curvy, right? So if you have exposed root, you're not going to be able to floss that, shapely space. You still want to do something for the contact, for in between the teeth, but using something that's going to flush it out is great. And I have many patients who do brushing, and then they floss, and then they use the water pick, and they're shocked by how much is still coming out.
Well, it's not necessarily for the food, for the particles.
Well, not just for the food, it's for the
When you
plaque.
have pathogen colonies, once they've broken up, they won't solidify. So it's the most important thing to me is to get those colonies broken up.
Right, to disrupt the colonies. You want to disrupt the
How do you do
colonies.
that the most, Phil? With what kind of thing?
Just by whatever you're doing, but a water pick or especially a sonic air will disturb those colonies,
Right.
and that's because when you form a colony, then you're producing acid, and acid's dissolving your tooth.
Okay,
Right.
good, thank you.
Right, you want to disrupt the colonies so that they don't cause more acid. And ultimately, also, one thing that sometimes people don't realize is that the bacteria that is the nastiest ones are anaerobic, so they don't like any kind of air. So just by the act of, but just by the act of, messing around there is going to make a difference. That's why for people who can't floss, if you can use toothpicks, just do something, because you want to just not give them the opportunity.
Wow.
There you go. Cocoa floss. Okay, this is one of my favorite flosses.
Mine
It's
too.
not my favorite, it's just one of. This is made actually in San Mateo. It's instead of wax, it has coconut oil, which is an my brain stopped. Antibacterial, thank you. It comes in different flavors. It doesn't really, you can't really taste the flavors, but my favorite is actually Dr. Tung's, Tungs, because it tastes like cardamom. It's actually
so
really amazing and luxurious. Cocoa, yeah, see, we got a thumbs up. Cocoa floss has a bit of that same luxuriousness, but it just doesn't have the cardamom. So it's not
And
my
I-
favorite.
How do you
And I
spell that
love all the
again? Doctor-
flavors, it's strawberry.
Doctor,
and
D-R, and
coconut
then
and-
T-U-N-G-S, Dr. Tongs.
And my favorite is the cocoa floss.
And the cocoa floss. I mean, it's all good, yeah.
So I wanted to talk about this. This is ozonated olive oil, and how many of you have heard about oil pulling in the Ayurvedic system? Hooray, okay. So, oil pulling, when people switch coconut oil to their mouth, it actually pulls some of the bacteria into the oil, and then you spit it out. But you don't spit it out in the sink, you spit it out in a waste can, because otherwise you don't want to clog your sink, okay? But something that I've been doing that has been helping me control any cavities on top of my nice veneers, which Phil put in, thank you,
Well done,
is
Phil.
ozonated oil that I swish with this, then there's a film of ozonated oil, and then I run through this with a toothpick along the very edge, which is where I tend to get all my cavities. So that's another tool, and there's a picture of it.
Oh, it was the one that was just there.
Oh, okay, fine.
Oh, good, I have a big toothpick.
It's called a Perio Aid.
So, you can get these online. There's, if you need information, just let me know, I'll tell you where. See, I'm using a very big piece of toothpick against a very big mouth. And so what she's talking about is she dips the toothpick directly into the olive gold. So olive gold has ozone in it. Ozone is 3 molecules of oxygen, and it's not, it's accepted by the body like it's not a foreign object. So, because it's oxygen, it breaks down into oxygen. This actually has other essential oils in it, and there are some that have flavors. So what she does is she squirts a little bit in something, and I actually have little cups. If you guys want to try any of these things, you can try them. And then she takes the little wooden pick and then dipping it in the oil and then rubs it into the in-between space. So,
Right, thank you.
That's exactly what you said, right? But so what happens is that it's got a benefit that not only are you mechanically removing the bacteria and the plaque, she's actually also introducing the ozone right into the space. So you can use it with a little wooden pick. You can also use a rubber tip, which I'm a fan of as well, because for those pockets, remember we talked about pockets being a little bit deeper. So if you take a little rubber tip, you can go in deeper. So even though it's not designed for that use, it's designed to just massage the gums in between. I like it to actually go right up into the space as deep as you can to kind of sweep out whatever's there. You stimulate the gums and you introduce the ozone or whatever else you want to put there that's therapeutic. Did anybody have questions about that? Great. Okay, toothpastes. So this is where, going back to the calcium phosphate. So these are toothpastes that, one of them is for kids. It tastes like berry bubble gum. It smells good, I've never tasted it. And the other one's mint, and it has coral in it. And the coral actually is where the calcium phosphate comes from. So it's just adding back those minerals into the person's teeth. And in our office, we actually do not use fluoride on kids. So if you remember when you were a kid and they give you a fluoride treatment, we don't do that. We actually do calcium phosphate minerals. And unfortunately, because it's not fluoride, it's not covered by insurance. Insurance will cover the neurotoxin, but not the calcium phosphate.
God.
Just as a heads up.
Okay, and I want you to know that this, when I went to, when I went first to.
I'll go back to the mic, I'm sorry. I'll go back to the mic.
Yeah. With respect to my dentist, this was the first dentist that I went to that didn't just like give me this toothpaste, but he said, do different toothpastes throughout the week or through every 2 weeks, because the bacteria, some of the bad bacteria learn how to mutate and survive. So you introduce a new one. So now I have so many different toothpastes to choose between. This is for alkalinizing. This is for alkalinizing. This gets rid of plaque. It's one of my favorite. Livinex gel. This restores the microbiome. This puts good bacteria in our mouth. This could be like a finishing touch. You have to tell me about Bryotex.
It's just, there's so many different kinds. The idea is, there's so many of us in here, everybody's gonna like one more than the other at a certain point in their life. And the idea is to continue to wake your mouth up. So when you do something new, there's a reaction, your body responds. So you wanna just keep doing that periodically so that it's not like, okay, we're just doing the same stuff and just like Lori said, your body gets used to it and then you're not
And I
having the
just
same
got
benefit.
this has calcium phosphate
That's
in
calcium phosphate.
it.
It's
And a very
derived
soft
from dairy.
mousse, and it's
Yeah.
melon flavored.
I use that for people who have
That's it.
sensitivity or who are having
Yeah, I
bleaching
don't like
because it doesn't, it's like sweater on the roots. Yeah, go ahead.
I learned from my health practitioner actually that the pastes block up the glycerine or whatever it is in there, blocks up the tubules in the tooth. And so it's not a good idea.
Well, so one of the things that you said is that some of the toothpaste, you've got to read the different ingredients and see if it's in alignment for you. Having the tubules be blocked is helpful for people who have sensitivity because they may have so much of their root that's exposed that, especially also if you're going to get your teeth cleaned and then something's going to be scraping in the cold and the water and all of that stuff. So it's nice to actually have something that's insulating. I've actually had a patient who uses the MI paste who used to just, white knuckle it, which is not something that I like for my patients. And so I had her start to use the MI paste, and now she can have just like the regular cleaning like everybody else. No problem. No sensitivity. That's so huge. So, yeah. Anybody else? Okay.
Yes, I have a question.
Okay.
If there was a one-stop shop for not so I'm lazy, but just someone wants to keep it simple, one toothpaste to stay with, which one would you go for?
Yeah, that's my
Okay,
question
so
too.
here's my thing. Here's the secret. I usually rarely use toothpaste.
Okay.
So, and you said that there was a hygienist who said to you not to use toothpaste.
Well,
Because I believe in the mechanical removal of the deposits of the plaque. So I don't put toothpaste on my floss, for example. And so in my logical mind, I think, well, if I don't need it on my floss, then why do I need it on my brush? And thankfully, I'm doing well, but I'm a hygienist, so you've got to keep that in mind. So occasionally, I will actually use the MI paste because I also like to have my teeth white, so I sometimes will bleach them, touch up. And so I don't want to have sensitivity, then I'll use the MI paste. Or if I know I'm going to get my teeth cleaned by the hygienist, because I can't do surgery on myself. So then I'll use MI paste because I just anticipate, and I'm actually a dental phobic, which is kind of ironic.
What's MI paste?
That's the one that the foam, the mousse.
Oh, yeah, we have.
It's recaldent.
What is recaldent?
Where can you get all
It's-
these things?
Okay, well,
Online.
yeah, the
They're all online.
I
recaldent
just found
tends to be something that you can get online, but it tends to be more like you've got to get it from your professional, from your dental office.
Because the MI paste.
I know that one's not my favorite.
Smells like there's tea
Which
tree.
one is that?
Oh, it's tea tree.
Oh yeah, it's got tea tree.
Very medicinal.
Yeah, so I don't know if that was helpful. For some people who want their teeth to be whiter or they get lots of stains, then I would say using a charcoal toothpaste is good, but you can also make your own. You can, for people who are sensitive, you want to use something that has calcium phosphate in it, so then that's going to help to make the teeth a little bit less. Then some people, want to add minerals back. It just depends on what your personal needs are. And I would mix it up, just like I mix up my shampoo. I don't use the same shampoo. Just kind of things get built up is how
So
I imagine.
my studies of the immune system, I highly recommend switching around. And also, like one of my favorites is this Livinex gel dipped in a little bit of charcoal. And you can also use coconut oil and dip it in charcoal. And the charcoal alkalinizes, and you said the GC mousse alkalinizes. And remember that an alkaline environment the bacteria don't like it, okay? It helps preserve our teeth.
Great. It's just.
So to whiten teeth, you'd recommend the ones that say whitener that you have?
Yeah, I like the whitener. So charcoal actually can whiten your teeth, but just be warned, it's black. So when you
have to rinse it off.
You gotta rinse it off. So, but what I usually suggest is you want to brush with it and then spit in your hand, because otherwise it gets everywhere, and then you can rinse your hand off.
Good point.
I also suggest not necessarily rinsing, so you might want to just spit it out and then go to sleep and let that charcoal stay so that it absorbs whatever toxins are in your mouth. And then in the morning, you scrub.
Yeah, that's what I did when I first explored it, is I just spit, I didn't rinse. And so the charcoal was there alkalizing my
Exactly.
mouth while I slept.
Exactly.
And your sink.
What?
But it wasn't
And your
making-
sink.
In her sink.
And
yeah.
the sink, right? So you got a
Oh,
twofer.
well, it was alkalizing the sink for a little while, yes. But I mean, I just want to say that the difference between spitting and rinsing, I never thought of that. Yeah.
There's a debate about glycerin.
You
in
probably
toothpaste.
know more about that than I do,
Because
honestly.
he doesn't agree, and he's the only one.
He's the
I've
only one
found.
that doesn't have the
He's got
glycerin.
glycerin in his toothpaste,
Yeah.
and he says the other people are, but I don't understand his argument.
When you figure it out, will you let me know? I
Okay.
have to say, this is not my area that I can,
Okay.
that I can speak to. I just, again, suggest that you check with your own intuition, see what works for your body. I hate to say it, but there are some people who even use Sensodyne, and they swear by it. It has fluoride in it. I'm not a fan, but it's like you've got to figure out what works for you and what's best for you. So, and I really don't know enough about the glycerin debate to speak to it. This is another type of toothpaste, colloidal silver toothpaste. That's actually what they used to use before antibiotics, they used to use colloidal silver. So I'm not sure, does it kill all the bacteria, does it kill some of the bacteria? Again, you've got to kind of just research. We were just kind of trying to show you all the different options. Again, a reminder that the tooth mousse is derived from dairy, so if anybody has allergies, it's not like the coral one that comes from coral.
So there are also, the Bryotex.
The Bryotex spray.
This is the Bryotex spray, and Samira, you should talk about it, and I use it, and I like it, and you can try it right here. I'm
Yeah,
sharing.
so the Bryotex spray is, it says topical skin spray, but we consider that the gums are part of the skin. And there's actually a mouthwash version of it. It's got the same stuff
Pass
in
it
it,
along,
but it tastes even worse, just so you know. We have it for you to try. What's nice about it, it's hydrochloric acid, it mimics your immune system. So I'll tell you a very quick story.
So spray and pass.
Yeah, spray and pass. You can spray it on your face, you can spray it in your eyes. We had somebody who had a little sty that was starting in her eye. She sprayed it 2 nights, it went away. I've had cuts where I've sprayed it on my cut and then wear gloves, and it helped. It healed it faster. It's in my first aid kit, so I don't use Neurosporin. I just use the Bryotex. When I go
Wow.
traveling, I take it with me. I spray my kids.
Wow.
I'm like, we went to
And I
India,
think
we
it
didn't get
tastes kinda
sick.
good
So
myself.
I actually do like the spray better than the mouthwash. But so what happens is, we had somebody come into the office and we had a pilot. They were having us test this machine to see if it was viable to use in dental offices, where we take a swab of the person's mouth and measure their pH and the bacteria count and their inflammation and all the different things. And so we were just telling them whether it would be something that was useful. We had time, so I checked on the patient that I tested him
So take a
first.
picture with your phone rather than take the time to write all
Yeah.
it down.
And
So everybody can try it.
you can
Yeah.
spray it. You can spray it on your face and your eyes. Yeah, everywhere.
In your mouth.
In your mouth, and you can swallow it. But so we did it. We did the test, and then he had a certain amount. His pH and his, S. mutans, which are the bacteria that cause decay, was a certain amount. And it was like, okay, great. Let's just test the Bryotex. So we sprayed it in his mouth, and then we had him do the spitting, and then we're measuring it just in the machine. His S. mutans, which are the bacteria that cause decay, went to 0, like in, the amount of time that it took to just do the test. And so after that, I'm like, okay, I'm sold. So, this is again my go-to. It's one of my favorite products. This one and the olive gold. If you don't go with anything else, it's the olive gold, because this one also is great. You can use it on your skin. Sometimes people have something that the spray isn't so great for. You can use the olive gold. So it's nice to have something to toggle back and forth. Let me just make sure I'm just being mindful of the time.
Right, and I also want to pass around, okay, so let's say you'd like to boost your microbiome in your mouth. So this thing, Dental Probiotics, is L. salivarius, which works against any kind of decay in the mouth, and love it. And it's got L. reuteri, which is a microbiome that helps reduce risk of cardiovascular disease. So I'm going to pass this around. You can all chew one and enjoy it. And this could be like your finishing touch, like your aperitif,
Yeah,
except
because you get rid of everything, and then
Okay,
you replenish
so
it with the healthy, happy, good stuff,
anybody
right?
just
That makes
take
sense.
one and pass it along, and rather than take the time to write it down, please take a picture with your phone.
And here's a different type of probiotic, same concept.
Yeah, that's Life Extension does that one.
Right. Here's coral powder, coral calcium powder, for those of you who don't want to use the toothpaste, if you want to make your own, or for people who
So let's pass it around.
have a tendency towards having decay or like problems with decay in between their teeth. This is something that I recommend for kids quite often. We have the kids just, you dip the finger in and you get some of that powder on your teeth, and then you floss. So you're actually flossing the minerals right into those in-between places, which
you take a picture
no-
later with your
nothing
phone.
really gets in between except for the floss. So if you put the minerals on
Dental
it
Probiotics.
and floss, it's going to be even better.
Here, Jeffrey. Did everyone get one?
You just brush your teeth with it?
No, you can just dip your finger in and get the powder, the calcium powder. Yep.
Trevor, here.
Let's see, what else do we have that's exciting? Oh, okay, this is the oral collection kit that she was talking about. Okay.
That's for the HPV
Oh, self-collect.
virus. Yeah. So you can recognize it. And selfcollect.com. And then after that, I want to talk about this.
Which one is that? Oh, do we have a slide for that?
This is the start.
Oh, here's the start. Okay, great.
So I want to let you know that nitric oxide is a really important little gas that we have in our bodies. And sodium nitrate converts to nitric oxide, which is absolutely essential for a man's erection, and for a woman's clitoral erection, and for erection in her nipples, everywhere, all right? But it's beyond that. It's also for growing and enhancing vasodilation in our coronary arteries, in everything. So, and it can reduce blood pressure. So when people were using things like Listerine and alcohol-based bacteria, it was killing the bacteria in their mouth. And fluoride can kill the bacteria in your mouth that can produce nitric oxide. And if you could see
Alcohol
here,
can do that.
yeah, alcohol and fluoride-based toothpaste, fluoride-based gargles and alcohol-based gargles. All right, so these are healthy mouthwashes, but I'd like to go back to that picture for a moment. The reason I got this is because I have borderline high blood pressure. So of course I'm studying vasodilation, okay? All right, so here's the bacteria in your mouth reducing nitrate to nitrite, okay? And then it goes down here, the stomach acidity brings it back from nitrite to nitric oxide, and then nitric oxide goes back to nitrate, and then the nitrite is circulated in your blood, and it causes vasodilation, you know, in all the sexual organs, in your nose, your coronary arteries. It's very, very healthy, and it goes down as we get older. So it's critically important. So how, you know, if we want to have full sexual vitality, if we want to have, you know, healthy blood vessels, okay? And if we want to have blood vessels in our brain that are open enough to get good circulation there, what do? We do things to enhance our nitric oxide. And first of all, we test for your nitric oxide level, okay? And most people, everyone in this room, I can pretty much guarantee you're going to be low. Because these are the things that boost nitric oxide. Eating beets and citrulline amino acid. And you can do it in a simple way by taking something called Neo 40, available on the web.
Arginine too.
Arginine can do some, but nothing like citrulline. And arginine with older people doesn't work as well as citrulline, okay? And the beets have the nitrate in them, okay? So this is a mixture of citrulline and beetroot powder. And, you know, and so another thing that I started taking, because I have some tendencies this way, is Nitrovasc with life extension. So not only am I sucking this, which is a nice thing to suck. Oh, sorry. Yeah, thank you. But I'm taking these pills, and I've just recently brought my, and I always test every morning to see how my nitric oxide level is. And I brought down my most recent blood pressure down from 123 over 75 or 70, which was pretty low as it was, and it went lower from 130 over 75. I was hitting levels of 115. So systolic hypertension is something that increases with age, and it can be positively correlated with strokes. So, you know, I don't want any part of this. So anyway, but I'm recommending this for everybody. And, you know,
Do you have to test it every morning with that kit?
I do it because I like testing myself. Yeah. And, you know, I like the affirmation, and when I did only this, it was in the optimal range. Now it's in the super optimal range because I do this as well. And my blood pressure has gone down further, which is good. And Life Extension recommends like about 115 over 70, down from 120 over 80. And I am a follower of Life Extension magazine and testing. So, you know, I mean, we're all doing the best we can, trying to figure out how to have the most maximal life.
What is that other
I
one
missed
called?
part of that. Was Life Extension a product or is
No,
it?
lifeextension.org. I recommend every one of you go to lifeextension.com, excuse me. Is an excellent, they send out an excellent magazine every month. They talk about key nutrients you can get to help yourself. They give a whole list, usually 30 to 40 journal articles that support what they recommend. And of course, they're trying to make money with their supplements, but it's well validated. And I go to the anti-aging medicine conferences every year, and those things are validated there. And also, something that I'll teach in later presentations is how to order your own tests and study them and get far more attention than any doctor will give you. And more accuracy and relatively low cost because it's group buying. And they give you a free counselor with every test you take and every result to fully understand it and take nutrients to work this. And sometimes you have to get a prescription. I'm not saying you don't, you know, but in terms of promoting general health, it's excellent.
What is that other bottle called that you have in your hand?
Nitrovasc.
Natural.
and Neo 40.
Thank you.
And this comes, if you go on Amazon, this comes with the test kit like this, okay? So you can know exactly where you stand. And there are other tests too, like vitamin C checks and other things. But, okay, so we're getting close to the end.
We're getting close to the end.
Yeah.
So one more thing, and I think you wanted to just talk about different mouthwashes, the same concept
Yeah,
around
that's the one
mouthwash.
to support.
Right.
That's not going to kill your bacteria.
That doesn't have
And one of the
bacteria,
things
that
that
doesn't have alcohol
I've
in it.
been worried about the colloidal silver toothpaste, frankly, because I didn't know if it was going to kill some of those nice bacteria
Right.
in my mouth.
But that's
But
where
they
it
say
goes back
kills
to
it
if
for
you.
12 hours. You
Yeah,
know?
so you may want to then, that's why there's
That's
a
why
certain
don't do it.
protocol that you would wanna follow if you were gonna use that. And then just make sure that you take the probiotics after, so that you're just making sure that you're putting back what is needed there, because you do need to have something.
Quick question.
Yeah.
Hydrogen peroxide, food grade, obviously, quality 3%. Would you recommend that as a mouthwash as well?
I would not recommend that as a regular mouthwash, because what happens is it doesn't discriminate, right? So you don't wanna kill everything. It's
Right.
like being on antibiotics.
Yes, okay.
There's lots of really good mouthwashes that you can use without having it to be like, you know, you don't need a sledgehammer. You can just use something. Actually, I mean, I brought one that's one of my favorites, was just Tooth and Gum Tonic. It's really, really strong, so just a little tiny bit will go a long way. And, you know, for people who want to have a
Is there
mouthwash.
alcohol in
It
it?
doesn't
Well,
have alcohol in it, yeah.
Well, I'm not sure if he's talking about the same thing as they have a dental rinse.
Yes.
Is
Oh,
that what he's
well, if
talking
it
about?
says it's a dental rinse, if
Yeah.
it's like specifically made as a rinse,
Yeah,
then, and it has hydrogen peroxide in it, then
Yes.
that I guess would be fine. I mean, again, I'm not a fan of just using straight up hydrogen peroxide, because what has happened when I've seen people who've done that, and we don't have slides of it, but you can grow a fungus. You can get, it's actually called black hairy tongue.
Oh,
And
my God.
and it looks and sounds just as disgusting as.
From hydrogen
yeah, from hydrogen peroxide, right.
How
Yeah.
disgusting.
Trevor, stick out your tongue.
Stick out your tongue, let's see if
Oh
you
my
like-
God.
Let's go to a barber to get his tongue checked.
Yeah, there you go. There's remedies for everything.
Use
Yeah.
1.5% peroxide solution, and, you know,
Okay.
put it in my water paper, put it down there.
Yeah, so your hygienist recommended that you use that for a specific site for a specific amount of time.
Yeah.
So that's different than, you know, just, you can be on antibiotics for a specific amount of time, but to use it ongoing is not something that I would recommend.
Okay.
Yeah, but
I
that's
have
a
been
very,
doing it for quite a
very
while
good
now,
question.
for-
Yeah, I would just check to make sure, you know, I mean, you're diluting it, you know, it's just, again,
Yeah.
you've gotta check to see what works best for
It
you,
seems to be working fine, and I'll stop once this.
once that tooth
once
has
the
been
tooth-
handled.
Tooth has been handled. I've been doing it for, 4, 5, 6 months.
Okay, well, I mean, again, you're being monitored, so, I mean, I guess that has been recommended to you, so I wouldn't wanna say don't do that. Yeah.
What about like saltwater rinses?
Okay, so I actually like saltwater rinses, but that's again where, you know, the SOS and the Bryotex comes in, because it tastes like salt water, and it's not just salt water. It's mimicking your immune system, and so I like that. Yeah.
Oh, I wanted to still try that. Could you hand me that?
You also, somewhere in the materials, you read something about
Impact
the relationship to osteoporosis, that somehow.
Yes, well, so with the fluoride has, you know, so again, fluoride is not a smart mineral. It's not gonna just stay on your teeth. It's not gonna, you know, I mean, the argument for adding it to the water that it helps our children. I'm no longer a child, and I don't need fluoride in my coffee that I buy.
Right,
So, you know,
yeah.
just again, like there's on that happy note.
And how can we stop water people from
I
doing that?
we didn't talk
You've
about
got-
the xylomel.
We didn't talk about the melts. Okay, go ahead.
Okay,
We'll talk about the
so-
melts
So
first, and
I
then we'll go to
used to have a
fluoride.
problem with the Toothpaste getting dry mouth, which enabled me to get more cavities, okay? So now I put one of these little things on my palate when I go to sleep, and my mouth is always moist in the morning. because my brain is saying, oh, something we have to dissolve here, you know, and it tastes like a nice mint. And it's also helped other people in their 50s, 60s, 70s who might have, we all tend to have drier mouths as we get older. And so it's a nice thing. And xylitol does not encourage any bacteria in the mouth. So,
Yeah, it's an inhibitor.
yeah.
They have candies that and gum and things that you can chew as well that has xylitol in it, but just be warned, you don't want to take too much because it can also make your tummy not happy.
It was
Yeah,
also,
no, just one
A
pastille.
little bit
is
goes a long way.
it's a really good idea to learn to be a nose breather,
Right.
because
Yes.
number one, you can't snore if your lips are closed. And number two, it makes your whole system work. It
And
keeps
it's
your
the
teeth wet.
Buteyko method,
Yeah.
where you take your mouth.
Take out
Yeah.
that exactly.
Another interesting thing is nitric oxide is also made in the bridge of the nose.
Mhm.
So that's when you teach breathing in through your nose and sometimes exhaling through your mouth, you're actually stimulating nitric oxide right here.
That's actually how your body regulates your breathing, because your body doesn't look at the oxygen, it looks at the carbon dioxide. And the only way that it can recognize carbon dioxide is if the nitric acid triggers the brain to say, oh, there's enough air here. So there's people who will continue to talk and they're talking to breathe, or they breathe and they breathe and they breathe. They're like hyperventilating because their body doesn't recognize that they actually are breathing sufficiently. That's why when we did the little opening meditation, I had you breathe in through your nose and breathe out through your nose. Because your nose, if you don't use it, it just becomes like an ornamental thing. So just kind of on that happy note. So, 1 minute to go. So here's a film on fluoride. It's a documentary, you can find it online, Our Daily Dose. It talks about where fluoride came from, when it started, and how, you know, the Industrial Revolution, and how they introduced 3 chemicals,
You
fluoride,
can all try that. what you're
asbestos,
passing
and lead, all at the same time. So 2 of those 3 have now been seriously removed from our environment, and yet fluoride still is there. So just something to think about. The root canal film. So this was on Netflix, and it is no longer on Netflix, but you can still find it on YouTube for now. Who knows how long? But you see the little skulls. She liked the little skulls on the teeth. So it talks about root canals and the impact that it has on your health. I don't want you then to go running out, and it doesn't mean that you have to take away all the root canals and now you've got to have, you know, just major overhaul. Remember to consider what's happening in your body and what's best for you. So again, that's just one thing. If you want more information, here's some other really amazing sites that you can check out, and a great book. So back to the airway and the breathing, so many of our problems are related to our airway and how we have our tongue placed. So you can see the relationship between the airway and the TMJ. The oxygen advantage talks about having different exercises that can enhance your ability to breathe. Obviously, it's a very important thing. MTHFR.net is an important website, so you can check out what that all means. We talked about it a little bit. Occlusion connections, again, same. The orthodontics is an alternative type of orthodontic appliance that helps to expand your palate. You can read about that as well. And 931, yes, okay, so here's my contact info. This is my office if you care. There's many offices that you can go to. This is just where I happen to work in, and I love it. And I thank you all for coming. Does anybody have any questions for me more?
What was that last one? All for, what was that? The last.
Oh, I'm
slide.
sorry, here's the slide.
All.
ALF, and then orthodontics.com.
Orthodontics, what was
Is that about a special kind of mouth
It's
brace?
a special kind of appliance because there are people who recognize that their airway is important to their entire body and functioning, and if most of us don't have a sufficient airway, it can be, you can lead it back to the tongue placement because your tongue applies 300 pounds of pressure per square inch when you swallow, and it does
Really?
that.
My God.
It does that so that it can help to form the bottom of your palate. So if your palate is arched and domed like a cathedral, if you've ever been up in one of those domes, there's not much airflow.
Oh, that's like mine.
Right.
Oh, wow.
And so optimally your tongue,
But you're a
had
good
it been
singer.
trained, you know, right, the MTHFR and the connective tissue that keeps people's tongues tied is somewhat limiting to have your tongue live where it's supposed to live, up in the living room upstairs, which most people's tongues don't do that. One of our favorite things that we say is your mouth, your tongue is kind of like a 6-foot tiger in a 3-foot stage. And so we have many patients who come in and their tongue just doesn't fit in their mouth. And so then if it's not fitting in your mouth, when you're sleeping, your tongue falls back in the back of your throat. The first thing that you do in CPR, you shift the person's jaw forward to open their airway. Well, your body does that for you at night. And then that's great, except that you've got teeth.
Does that cause sleep apnea to
Well,
have those?
sleep apnea, yeah, to an extent, because you're not breathing. So sleep apnea is a specific type of condition where you have to not breathe for a certain amount of time within a certain amount, it's like.
And I have severe sleep apnea, and when I was tested, I had 58 incidences of sleep apnea in an hour.
Wow.
It's called severe, and I have that very arched roof. It actually, I learned from you, Phil, comes from my African ancestors, and it's one of the reasons why African people sing well.
Oh.
They're, they have this arch,
Acoustics.
but it also should cause us some problems here.
Yeah, but so an ALF appliance is an appliance that you can use that can help to
Which I have
expand
in there.
your palate,
We didn't
so
show
that you
that.
can hopefully open up your airway a little bit. There's different things that you can do if you have a challenged airway.
There's I ordered it online. It's called Singing for Snores and Sleep Apnea. I just ordered it. It's
Nice.
singing exercises that you do to strengthen your soft palate.
Right.
Yeah.
Nice.
Well, that's where, the Oxygen Advantage, he's got exercises in there for you as well. So there's exercises you can do for your tongues. There's actually physical therapists that you can see that can help train your tongue.
The Buteco therapist.
Exactly.
Mhm.
Oral myologist is the name of the therapist. If you need one, let me know. I can recommend. And so you can, at the very least, if you are not having sufficient airway and breathing, I like to say your body doesn't know if it's your airway or if it's a terrorist that's keeping you from breathing, but you're not resting, and whoever is your bed partner is probably also not resting. So it's
Right.
something that I hold really, really as an important aspect of health. If you're not sleeping, you're stressed. You're not breathing, you're stressed. Welcome to the culture we live in. Did anybody have any other questions on that really depressing note?
We're all going to be moving into greater and greater oral health,
We'll
right?
go to Fiji. They don't have EMFs there. Just kidding. They probably have EMFs there.
The next one where it had all your information about
Yes,
the.
absolutely. Right
just
here.
the screen. So if we wanted to say schedule like a new patient exam.
Yes.
Because I'm looking for a new hygienist and a new dentist too. I'm about to fire an old dentist that I've had for the past 25 years. So I'm interested. How long would it take to get into the office and?
It depends. I mean, I'm kind of booked fairly solid, but people cancel, and so I would suggest that you schedule something somewhere, and then
And
get
then
on the call
keep
list and
calling.
keep calling, and then see when you get
The
in.
greasy wheel.
Yeah.
I mean, keep.
The
keep
noisy
calling.
wheel.
The squeaky wheel.
Squeaky
thank
wheel
you.
gets all the oil.
Yes, right.
That's what they say. So
And no,
just
it
be
really
squeaky.
happens. It really happens. Just calling nicely. How are you doing?
Exactly.
cutting, opening. That's what happened to my son.
Yeah. And the polishsmile.com, that's my website because I am a medical intuitive. I specialize in helping people clear dental trauma that's stored in the mouth. And so you can also check me out. And I think that's about it.
How do you know that you have trauma stored in the mouth?
That's a very good question.
Mhm.
Well, how would you know? Well, how do I put it this way? I once took a class where I asked, once I take this class, which is all about expanding my self-expression and all of those things, and I said, do people get divorced when they take this class? And so it was like, 3 other women had the same question. We all got divorced at the end of that class. So just kind of puts it into perspective. Well,
Now, how
the
do
way that
I,
I-
how do
so-
I know?
so I would say, what you want to consider, what I actually talk about
Yeah.
with dental trauma is that whatever you take into your body has an energy to it. And so, one of my favorite films that I actually have shared with other people is Like Water for Chocolate. And that film is about a woman who shares her emotions by food, by feeding. So if you've ever had like your grandmother's favorite rice pudding, it's so great because it's got her love in it, right? Well, that only lasts in your body however long it lasts, right? But if you happen to have somebody put something in your body that lasts decades, not counting Phil, but not if you send something to the lab and the lab technician happens to be cranky and they're putting that crown together, perhaps that crown may have something going into that's going to be living with you. Or dentists having number 1 suicide, being, substance abuse, depression. These are people who are working in your mouth, and in the same way that if that bowl of rice pudding was delicious for you and you're sensitive, perhaps that can also have an impact when somebody works on you. Or just very simply, you walk into a room, people have had an argument in there, you can feel a little uncomfortable. Well, the dental office doesn't tend to be a very happy place for people. And you're sitting in a chair that might have been white-knuckled just before you. And so these are all things that I kind of want people to consider. Does that mean that you have stored trauma in your mouth? I can't necessarily answer that unless we were having a session. Call me. But that's my quick explanation.
Might be good for you, Natalie, because she lost your 2 front teeth or something.
Yeah.
When you were a kid, and then all these operations you had.
Yeah. I am a walking nightmare of a dental. It's like every time I go to the dentist, they find something wrong, and I since a kid, it's always if it's not one thing, it's another. I've had like root canals and apicectomies and surgeries, and just always it's one thing after another. So, and I clench my teeth at night, and I know that's a stored dental trauma.
Well,
I know I have.
and also not to cut you off, but think about it. Like, how many times are you angry, and you're like,
Yeah,
right?
Yeah.
We do that. So, I mean, does that allow the free flow of whatever you're experiencing to go through you and out, or is it holding it there? And then how many times as a kid, something happens, and then you're like, okay, I'm gonna just, grit my teeth and bear it. So all of those things can impact, and that's one of the things I look
There's
at.
very few dentists that really understand how to equilibrate a mouth.
Right.
Very few.
Right.
So, when they put this filling in over here and they don't balance your mouth
Right.
out, what happens is your teeth don't hit right. Your masseter muscles say, I'm gonna damage my mouth if I close it too hard, so they lock your jaw up. It screws messes your whole system up.
Right.
And it's really sad, but a lot of times, a lot of these problems that people have with gum disease or
Right.
headaches or heart attacks are just because they're in malocclusion.
There may be that's a very good
And
point.
I see it all the time.
It's a very good point. I mean, unfortunately, it's just, people go to their dentist, and, the idea is that you should be seeing someone who's not a tooth mechanic. It's, you're an entire person, and so just recognizing you're not just kind of giving them your teeth and surrendering. You want to have a happy and healthy relationship with whoever it is that's working on you, and especially when it's something that's so intimate that will impact for decades later. I once had a patient who came in who always needed to have nitrous. She was always very, very phobic, bleeding gums, pockets. She couldn't get herself to floss. She couldn't get herself to do any of the things. And when she was on, having the nitrous, I get intuitive information while I'm working on people, and I asked her, is it okay if I chat with you about that? And she said yes. And I said, well, it's interesting because I'm thinking about my sister who also needs to have nitrous, except for when I clean her teeth. And it's because she had a dentist who did bad things to her when she was a kid. And about 30 seconds later, the patient started crying. She said, "Oh my God, that's what happened to me. I had to see a dentist who was my neighbor, and he did bad things to me." And I said, "Oh my gosh, I'm so sorry." Holding space for her. She had never shared that, and she had never really actually recognized that it could impact on her experience at the dentist. Well, she graduated from needing to have nitrous. Her gums stopped bleeding. She started to have a healthy mouth, because what happened was she had collapsed the information that he was giving her about her own health with his actions. So she couldn't, her taking care of her mouth would have been being in agreement with his abuse. And so she couldn't do any of that. And so when we had our visit, she was able to have that release, which was just incredibly profound. And that was actually one of the things that set me off on recognizing that, yes, I need to actually help people around whatever they have that's stored in their mouth, because it's not really being addressed. And so that was very moving for me.
Wow. Wow, thank you for that story.
Yeah.
Yeah. So I want to thank you all for coming. I feel we've all grown, in this further. And we'll be doing another one. And if you have specific requests at some point, we'll do something in the fall, And thank you, Samira.
You're welcome. Thank you all for having me.
Tell your friends, and join the Sunrise Center mailing list if you haven't yet, so that you can stay tuned and we can help the whole world have a happier, healthy mouth and smile.
Thank you, Laura.
Thank you.